All right. Well, very excited to be talking to our director, the NAL Director Brent Edwards, PhD, today about the current and future states of AI in hearing healthcare. So, Brent, thank you for your time.
Yeah, looking forward to this discussion.
Great, great. To start off, can you tell us a little bit about what the current state of AI in hearing healthcare is?
Yeah, sure. The hearing aid companies have been going full steam on AI for quite a long time, for many years. And AI has actually existed in hearing aids for a long time, but with, small benefits to the client. What's changing now is there's been a dramatic acceleration of the use of AI in hearing aids, primarily because of the ability to put deep neural networks in the hearing aid itself that is producing dramatic improvements to speech and noise. So that's a very exciting start to the real strong application of AI in hearing aids. But where I think what's most exciting to me is the application of AI in hearing healthcare services in the clinics, because I think there you have a diversity of opportunity for AI to help the audiologist, help the hearing care provider, help the client. And so we have seen an introduction of AI with things like AI scribes that listen to the conversations an audiologist has with their client and automatically creates clinical case notes. I think that's the first real introduction of AI for use by hearing healthcare services. But there's so many others. I'm very excited to see what comes next.
Great. And do you have any clues to what that might be, but what comes next? You've talked a bit about DNNs in devices and then the service side innovation. What are your thoughts about what that future might hold in either of those domains or something else?
Yeah. So what I've done throughout my career is look at what's happening in other fields of healthcare as, sort of guidance on where hearing healthcare is going. Because quite often, in hearing, we lag behind some of the other healthcare fields for whatever reason. And there are other healthcare fields, such as radiology, where AI is quite extensively used now, and they're a lot more mature in the application of AI to healthcare. So, if we look at where AI is being used in other healthcare areas, I think that's a good indication of where AI is going to help us in the hearing health world. The first and simplest is simply using AI to train the healthcare practitioners. And there's a variety of ways that can be done. We at NAL have developed a training tool called virtual personas, but it's really about you don't need a live instructor now in order to provide very sophisticated ways of training physicians, clinicians, nurses, that kind of thing. AI is being used to help screen and triage patients and clients. So taking a look at their symptoms, their complaints, and figuring out who they need to see right away automatically based on large data sets. And now we've actually done this as well to try to understand, what kind of needs people with hearing loss have who present to clinics to figure out who needs more in-depth care. Obviously, AI can do a very good job at diagnosing conditions. Again, if you look at radiology, they take an image of, say, your chest and can now identify up to 140 different conditions that might be very difficult for the human to do. And so it's really an assistant in helping the healthcare practitioner, taking in all the data, all the symptoms, looking at millions of cases that exist and saying, this patient looks just like, this group of patients over here who have been successful with certain kinds of treatment. And that advice on the treatment kind of goes hand in hand with diagnosing using access to big data and all these clinical records that exist from the past. AI can also help the patient and the client after they've left the clinic. So, the audiologist, the hearing care provider, their job is kind of done once that client walks out the door. But with an AI tool, the AI can continue to offer advice, can continue to help, can continue the conversation to encourage hearing aid use and the hearing aid best practices. So it's also almost like an assistant for the hearing care practitioner, after the clinical appointment. And then finally, the most obvious one, and again, I've mentioned we're seeing this in hearing care already, helping with administrative work. things like writing up clinical case notes, automating some of the stuff that, hearing care providers probably find a little boring and isn't what gets them out of, jumping out of bed in the day, but has to be done. AI is really good at automating sort of rote, mundane tasks so that, healthcare providers can focus on what they're so good at.
Yeah, I've never heard anyone ask for more paperwork to do. So that last benefit, I think, would probably be something many professionals in audiology, in hearing healthcare, and other fields would find exciting. But do you think audiologists are excited, or do you think they might be or should be concerned about the introduction in terms of some of those clinical decision making and professional best practice applications you were talking about?
Yeah, I mean, that's a great question because I get a lot of questions from audiologists around the world who are concerned, mainly concerned about their job and the profession of audiology, because there's a lot of noise in newspapers and articles and TV shows that AI is going to replace everyone. And all of a sudden, you lose all the workers and just AI does everything. And again, here I think we can look at radiology as an example. 10 years ago, AI was introduced, and a lot of experts are saying, well, radiologists are out of a job. We don't need them anymore. AI can do everything that a radiologist does. Well, guess what? Radiologists are more in demand today than ever, and their salaries are astronomical because they're in such demand. So AI has actually enabled them to be more effective and be more useful in a variety of ways. And so I think that's going to happen across healthcare. It's going to happen in audiology, absolutely. AI is going to be a tool that will make hearing care practitioners more effective, more capable. They're going to be able to treat more clients more effectively because we do have a growing elderly population that are going to need more audiological care. We don't have a growing audiology or hearing care practitioner population. So AI is a tool that can really help the healthcare practitioner focus on what they're best at, which is helping the patient, advising, building that trust, counseling, and AI will just make them more effective, faster, better at it. So it's a tool, just like the introduction of computers to healthcare. AI is just the introduction of another tool that will help audiologists, hearing care practitioners be as good as they are.
Yeah, great, great. So, I mean, there's a lot of upside, obviously, and we have that economic argument that if you increase the value of the service, then there's more value to go around, and that
yeah,
kind of lessons can hopefully in the future address concerns across healthcare. But what about concerns about that tooling itself? So about AI. So we hear about things, people like me who aren't experts, like hallucinations and biases and issues with accuracy. Do you have any thoughts on those?
Yeah, this is really important, especially in healthcare where people's health and lives are at stake. I would say to the healthcare practitioner, it's not your job to understand the biases that any potential biases in the training of an AI system or the accuracy. You need to be aware of these things if you're responsible for selecting tools. But ultimately, as with any medical device, there are regulatory bodies that are going to ensure the safety and efficacy, the effectiveness of any AI tools that make their way into healthcare. Government is also producing regulations on the application of AI everywhere, not just healthcare, but banking, automobiles, and all of that. So a lot of people are looking at this. It is an area of concern, but I don't think it should be of concern for the clinician because other groups are taking care of it. And by the way, I think you cannot abdicate responsibility as a clinician to an AI tool that you have. Ultimately, you are responsible for the care that you give to your patient, not an AI tool. No more than you blame software on your computer if things go wrong with your patient. No, you are accountable, responsible, and here you're going to have to think of AI as an intern in your clinic. They're smart, they're capable, but they're prone to mistakes. You are the professional. You are ultimately responsible for the care that's being provided, whether it's coming from AI or a textbook or Google or your own memory. You're responsible. And so all of these things about hallucinations, biases, and accuracy, ultimately it all comes filtered and controlled by you, the healthcare practitioner. So, I think the main thing is don't assume that you don't have to be as careful and concerned and ensuring everything is being done properly for that patient in front of you.
Great. All right. Thanks, Brent. So to wrap us up, if you're an audiologist today and you're in a clinic, what's something that you could go out and do right now to start to use AI? If you haven't before or you haven't consciously done it before, is there anything that an audiologist can do today to introduce it into their clinical practice?
Yeah, so I think the most important thing for every hearing care practitioner out there is having a positive mindset about AI. Again, there's a lot of concerns, and they're understandable, but the first step is recognizing that this is going to be an enabling tool that can allow you to do more and be more effective. So it starts with you, and it starts with your approach to how you think about AI that's coming. Even AI, you don't know what application is going to be yet. Be positive, have that positive attitude. Next, help your colleagues, and if you have any people reporting to you, help them with that positive attitude. So help make sure your whole practice has this attitude and that there isn't any fear of what's coming. There should be excitement about what's coming. Next is going to be, how do you address concerns from your client or patient? Because they're reading about AI, they're reading the same concerns you are. They're probably going to come in and say, I'm worried about privacy. I'm worried about hallucinations. What does this mean for, my hearing? What about AI and hearing aids? I hear there's AI there now. Is it listening to me? You need to be ready to have conversations about AI with your clients. And a big part of that is getting them to trust the AI. When it comes to healthcare, trust is one of the most important things. And we've seen in the literature that there is a distrust by patients towards AI in healthcare, particularly among the older population. So it's the hearing care practitioner's job to make sure that that client has the trust in what you're doing. And if what you're doing involves AI, they have the trust in that tool. And so if they trust you, they're going to trust the tools that you bring to provide that healthcare. But you got to be ready. You can't be surprised that they start questioning your use of AI and concerns. Be ready to address those issues. They're going to come with them. And I think my final advice is dip your toe in the water. Let's get going. AI scribes are out there. They work. There's publications on the benefit of AI scribes, and it's beyond just the simple transcription it creates. It reduces mental fatigue of the clinicians who use them. There's a lot of personnel benefit from using tools that makes people's jobs easier, and also better engagement with your patients and clients, because you're not as focused on just making sure you're writing things down, effectively. You can keep that eye contact with that client while having your conversation. So, get started with AI Scribe, change your mindset to one of positivity towards AI, and get ready for clients to express their concerns so you can build trust between them and the tools that you're bringing.
All right, great. Thanks so much for your insights on this topic, Brent. Really appreciate your time.
Yeah, exciting times. Thanks, Phil.
Okay.